Hi, everybody. Welcome to the EnvironMedicine Podcast. Today we have Uma Govindswamy, who is an MPH and a PhD candidate who is studying environmental health and is an educator at UTHealth Houston. Thank you so much for coming on today. I'm so happy to have you here. Could you please introduce yourself?
Sure. Thank you for having me. It's a thrill to be here and to support your podcast project. My name is Uma Govindswamy. I am a second-year PhD candidate at the Health Atmosphere Nexus Group, which is called HANG at UTHealth. The specialization of my lab is in applications of satellite remote sensing, geographic information systems, AI and machine learning methods in the context of public health and environment. So that's where my specialization is for my research. I've also worked in international development and public health for the better part of the last decade or so, and that's what my academic background revolves around as well.
Amazing. Thank you so much for being here. So I absolutely love the work that you do. I was reading through a lot of your publications as well. But before we get to that part, can we first talk about like your early life? What were your initial interests and how you kind of came to environmental health?
Sure. So I actually grew up between New Delhi, India, and here in the US. So I've spent about 14 years in each place at this point in my life. So I spent the majority of my under 18 time living in India. So when I was living there, my dad actually worked in sanitation and solid waste management. And so he started a private sector company to try and address the gaps that were present in our municipal and government level programs that were addressing solid waste management. So that's really where my interest in environmental health, I guess, began, is with him. India, among a lot of other countries, has a massive waste problem, and that waste problem often has toxic effects on the communities that surround it. And so growing up with that being role modeled to me, and example, like that example being my dad, it was not something that was necessarily avoidable for me in my career. And then from there, I knew I wanted to be more on the health side of things. So when I went to undergrad, I pursued a degree program that would kind of allow me to do both. Initially, I wasn't sure if I just wanted to do more of public health, but eventually I circled back around to environmental health a few years back, and I've been in the field ever since officially.
And both like New Delhi and Houston, both of them honestly have a similar issue with air pollution. Did you kind of see that whenever with your experiences in both cities?
I mean, definitely. I think there are different qualities of air pollution between New Delhi and Houston that are a little bit different. Just because here in Houston, we have the oil and gas industry that tends to have a larger impact on that ambient air pollution that we are seeing. In New Delhi, because we have such a high population burden, a lot of our air pollution burden comes from transportation. It also does come from industry. I'm not trying to say that. It's just we have a very densely populated area with a lot of cars and vehicles on the road. And so when you combine that spatial like perimeter being significantly smaller, we have a much higher population density, and then you throw in that ambient air pollution on top of it. That is like a very high risk population that we're working with back in India as well.
Yeah, it's really interesting to kind of see like the parallels between different places. But later during your life, you had your undergraduate education, and then you started working at UT Health as well. How did your academic and professional background lead to what you're currently doing?
Sure. So when I went to undergrad in North Carolina. I went to Duke University. I pursued a dual major program while I was there. So my BA is in global health and my BS is in biology with a concentration in marine biology. And I actually I believe it was my junior year of college, I took a class called Marine Climate Change, and it really gave me insight on how climate issues and environmental issues can have a really pervasive impact on populations that are dependent on the marine environment. So that was really kind of how I got my first academic exposure to the discipline. Before that, I had spent a while volunteering and interning for nonprofits. And then after I finished college, I graduated in the middle of the pandemic, which is always, a fun time to be graduating and in the job market. I was very lucky though, because I ended up working for the World Bank Group, who I had actually worked for a little bit during college. And so I was in their human development department. I was contracted with them for a few months to work on their portfolio on climate change and health. And so that's really where I began to start to refine my focus. I also at the time was working for the Center for Strategic and International Studies as a research intern in their Global Health Policy Center. And then before I went to grad school for a little while, I was with a venture capital firm based out of the Midwest. And they were really involved in finding seed and Series A level investments that were focused on innovations in health and healthcare delivery. So that gave me a really good exposure to what the market looks like, how to build solutions that are not only human-centered, but also commercially viable, sustainable, and have the right operational backing in them as well. So then when I went to do my master's, I did my master's at Emory University in Atlanta. So I went to the Rollins School of Public Health. I did my degree in global environmental health, which is cross-listed between their departments of global health and their environmental health department. And I kind of focused on health and climate. And that's really where I met my mentor. And I started working with her on my research on heat stress and overdose risk. That ended up being my master's thesis for my MPH. And after my MPH, I followed my mentor. She had left Emory. She'd finished her postdoc up, and she was offered an assistant professor position at UTHealth. And so that's actually how I ended up in Houston. Was I applied to the PhD program, and she supported my doing so. And so I was able to continue my work with her. And I really liked the idea of moving to Houston because Houston does have an immense need for the type of work that we do on the interface of environment, climate, and human health. UTHealth also has a really robust research center in and of itself, and it's well established. And so it was in a lot of ways a no-brainer for me to come on out here and continue doing my research here. It has been great in that I've been able to touch a lot of different portfolios here. So it's been a nice time for sure.
Yeah, that's so interesting. You have such varied experiences.
Yeah, I definitely think having a range of experiences earlier in my career kind of set me up very well for where I'm at now, because in my current role, I can function as a utility player. I wear a lot of different hats on my job day to day. You introduced me a little bit earlier. I am an educator as well. So I'm a teaching assistant in the Department of Environmental and Occupational Health Sciences. And I have been with the same course now since the spring, and that is public health ecology and environment. And then before that, I was teaching assisting for toxicology, which is through our Department of Epidemiology as well. And then I was also teaching assisting during my time at Emory. So I've been kind of assisting in master's and PhD programs for a while now. I got the opportunity this past year to develop my own internship program that is run through HANG, our Health Atmosphere Nexus group that I'm a part of. And so we launched that about a month ago. We did an open recruitment. We met with a number of students from around Houston who are really passionate about careers in environmental health and climate and health. It was really abundantly clear to us that this is a very personal thing for a lot of young people in Houston. They go through it, their families go through it, their friends go through it, and it has shaped a lot of their lives. So it was really meaningful that we were able to start this program. It's kind of functioning as a pilot as it is right now. I hope that in the coming years, we can continue to foster a younger generation being involved and being able to see what it is we do in climate and health work, because it is a very niche margin to be at.
Yeah, for sure. And that's kind of what we do at EnvironMedicine, like raising youth voices with regards to environmental health issues. And I can completely see how like youth who are directly interacting with these issues would be really passionate about them as well.
Yeah, and the other thing is, it's really amazing to see how many young people are so involved in their communities as it is. And it's really interesting to have our interns bring their perspectives from their communities and their own lived experiences and have that shape part of how we actually do outreach. Because the reality is, a lot of times in academia, we are shuffled kind of around the board, especially younger academics and researchers. We may be at one research institution for a couple years, and then we may move to the next one and the next one. And so we aren't necessarily as naturally built into the communities that we want to serve. Whereas for our interns, they have these are the communities they've grown up in. This is their whole lifetime of lived experience. And so we really enjoy having them because we're able to get a lot of really great youth-led feedback on what it is they're seeing on the ground and how we can incorporate that feedback back into our research, but also how we can communicate with communities more effectively and build that trust. And to kind of know some of those like sensitive points and those pressure points that we should avoid as researchers that we may or may not always be cognizant of when we're entering a new community and a new environment that we're operating in.
Yeah, that's amazing. And just touching on your like background in data science, how do you think that that has been able to change the landscape of environmental health research and like maybe for the better, and also what are some of its limitations as well?
Sure. So I actually took my first Geographic Information Systems, GIS class back in, I believe it was 2014. And so I took it when I was actually in high school. I did it as a summer credit program. It was offered through Johns Hopkins. And that was the first time I ever, used GIS in this in my career. And it actually, it ended up becoming what I do now for a large part of my work. I think, working in GIS and having a background in that was really helpful for me when I was older, because then I was able to re-engage that knowledge at later parts in my career. I think that data science in and of itself is the future of public health, in that, don't get me wrong, delivery, implementation, all those things are very, very important. But also, we live in a world where there is a wealth of information that is collected constantly. If we're not actually leveraging that wealth of insights to create meaningful change and to create sustainable growth and development, then we're ultimately not creating systems, in my opinion, this is solely my opinion, we're not necessarily creating systems that are going to be able to withstand a changing environment, a changing climate in the ways that they should. I mean, there's so much important health work being done around the world in so many different disciplines. But what's common to all of them is that their participants will always be interacting with their physical environment. They'll always be interacting with their built environment. They will always be interacting with air pollution, water pollution, toxic chemicals. These are all things that are unavoidable to the vast majority of the population. And so I strongly believe that building environmentally resilient health programming is the future of health programming as a whole. And I don't think that we can do that without data. Actually, I will say very confidently, we can't achieve that without data and without using advanced methods, that go beyond models that may not have spatial inputs built into them. I mean, those are very important models and they're appropriate at different times. But being able to have spatial insights into everything we do allows us to target populations. It allows us to address need in ways that are equitable versus equal. And so in that way, like, we're able to identify higher risk populations. We're able to do it with a higher level of granularity. We do a lot of work that involves NASA satellite products. And those satellite products are really valuable because we're able to get insight into everything from green space coverage to air pollution to cloud coverage to precipitation, heat stress. So I think that having that visibility and being able to integrate such a wide range of data capabilities really accelerates our ability as researchers to be able to understand those nuanced patterns. And, earlier I mentioned our interns and other community stakeholders that we engage in are constantly saying, we notice this, we notice that, we notice this, we notice that. And with that advanced level of data analytics, we're able to either provide context in terms of exposure or outcome to those claims that people may have, and we're able to provide them with better information and better insights. And ultimately, I think that is the goal of leveraging data science for public health, is to create better public health systems. And I think, there are a lot of people who are working really, really, really hard to do that. And I will say, I am very privileged to be in a lab where we're really doing that on the axis of, satellite technology and geographic information systems. But all the work that we do would not have been made possible in the slightest with all the work that came before us and all the work that happens around us as well. We have so many amazing academic and community and institutional partners that are doing the work on the ground that then allows us to be able to use our technology to translate that into meaningful real-time change. So
yeah, that's amazing. And you did touch on the difference between public health efforts being equitable versus equal. Can you just explain that distinction a little more?
Sure. So I can use an example from my current research, actually, if that's helpful. So we are just finishing up a paper. I've given a few talks on it, so the abstract is floating around in the universe. But we are finishing up one of the first papers that spatially analyzes overdose deaths in relation to heat stress. And so we did that at the state level. But our granularity of our models go down to the county level. So what we're able to do is, it is widely known. Our first paper is in West Virginia because West Virginia has the highest drug overdose death rate in the country. So we figured that was a good place to start. It would be data rich. And that was about 2.5 years ago when we started this project. And so West Virginia has 55 counties in and of itself. And so with our models, we were able to cross-reference areas that had a very high risk of heat stress with areas that have a very high risk of drug overdose deaths. And we were able to do that through about 5 different types of analyses, and we were able to understand the underlying variables as well. So one of the variables that we used was something called the Area Deprivation Index, which was developed by the University of Wisconsin. Shout out the University of Wisconsin for that. But we used ADI because it is an index that measures the degree of marginalization that a community experiences. And it has information for every neighborhood in the United States. You can actually Google it, look it up online. It's called Neighborhood Atlas, Area Deprivation Index. And what we were able to do is we were then able to basically almost overlay those 3 factors, and we were able to identify about 10 counties that were high risk in that they have a high heat burden, they have a high drug overdose burden, and they have a high rate of intrinsic marginalization within those communities. So then what that's able to do is we're able to go to policymakers eventually and say to them, we think that you should target these counties for distributing resources to as a priority, because they are the most high need, right? And they might be the most at risk during an event like a heat wave, right? And so being able to, on that granular level, identify spatially and temporally, how those communities are impacted over time and over space, we're able to really understand what storm, pardon my pun, what storm of conditions, environmental conditions, are creating high-risk environments.
Yeah, that makes sense
Yeah.
completely.
And
And yeah, go ahead.
sorry, we can just allocate resources better that way. That way we're not trying to send like 10 to 1, 10 to 1, 10 to 1, 10 to 1, when in reality, like they may all have different need burdens. Like one community may need 8 of something, one may need 12 of something per 100,000. You know, if we're talking Narcan distribution kits, if we're talking methadone, if we're talking peer recovery counselors, you know, these are all different aspects where we can kind of scale it based on need.
Yeah. Thank you for explaining that. But I know that we're running a little bit short on time right now,
No
but
worries.
can we just end with maybe some advice for our youth audience on how we can contribute to current environmental health efforts?
Sure. So, well, I strongly encourage all of you to volunteer, volunteer, volunteer in your communities. I know I might sound like a mom when I say that one. I actually started my public health career as a volunteer about, gosh, it must have been now almost 12 years ago. And I spent the first 4 years of my public health career volunteering and then eventually interning at a nonprofit. And I spent a lot of time at that one nonprofit, and I developed a really good working relationship with the people there. And they pulled me onto a wide range of projects. So I really recommend, like, a lot of times, like, there are going to be like programs that need extra support, whether that's, you know, hosting community events, things like that. If you have the opportunity to volunteer in your community on an issue that you are passionate about, do it, because honestly, that will give you real world exposure to what's going on the ground. And I think that has made a huge difference in my career, that's where I started, was starting with patients, starting with children, and starting with providers, and really being able to work with them one-on-one. And, you know, it's different for everybody. I would say, you know, people have to pick the opportunity that's what suits their alignment and what they want. But I think volunteering is a really great way to go. I think also, you know, there are internship programs, like there's the one at HANG. So if there are any viewers that are interested in our internship program, I think Gritty, you have my contact information. If anybody reaches out to you, just feel free to send them my way. If you're interested in career in health and climate, I'm really happy to support that as an individual in any way that I can. I think it is, you know, I do mentor students who are not in our internship program as well. And I think that it is really important that, you know, in a time where careers in public health are becoming harder and fewer and far between, that we as public health practitioners make sure we keep those doors open behind us so that nobody, you know, has to crawl through a metaphorical window to do the right thing in life.
And that's it for today's episode. Thanks so much for hanging out with us. If you like what you heard, be sure to subscribe, like, and leave a comment. If you'd like more, please check out our other episodes and follow us on our Instagram page at EnvironMedicine to stay in the loop. See you next time on EnvironMedicine.